Why do doctors sample chorionic villi during CVS? Imagine catching a glimpse of your baby's future health early in pregnancy. That's what doctors aim to do when they perform chorionic villus sampling, or CVS. This test is a way to check for genetic and chromosomal conditions in a developing baby. But why do they actually take a small sample of the chorionic villi? Let's find out. Chorionic villi are tiny, finger-like structures that grow in the placenta. These structures develop from the same fertilized egg as your baby, so they share the same genetic material. Because of this, they act like a window into the baby's genetic makeup. When doctors sample these villi, they can analyze the DNA to find out if your baby has certain genetic conditions. The main reason for sampling chorionic villi is to detect genetic or chromosomal problems early. Doctors usually do this between 10 and 13 weeks of pregnancy. This is earlier than other tests like amniocentesis, which is often done around the 15th to 18th week. Early testing gives families more time to understand the results and plan ahead if needed. During CVS, a small piece of the chorionic villi is collected. This can be done in a few ways: through the cervix using a thin tube or through the abdomen with a needle. The procedure takes about 10 to 20 minutes. The sample is then sent to a lab where specialists look for genetic changes or abnormalities in the chromosomes. This test is especially helpful for families with a history of genetic disorders or when other screening tests suggest a higher risk. It can identify conditions like Down syndrome, Edwards syndrome, Pothouse syndrome, and other genetic diseases such as cystic fibrosis or sickle cell disease. Knowing this information early can help families prepare for their baby's needs or make decisions about their pregnancy. It's important to remember that CVS isn't for everyone. It's usually recommended if there's a known risk factor, like advanced maternal age or a family history of genetic issues. The decision to have CVS should be made after talking with a healthcare provider or genetic counselor. They can explain what the test involves, its benefits, and possible risks like a small chance of miscarriage. While CVS can detect many genetic conditions, it cannot find neural tube defects like spina bifida. For those, doctors relying on ultrasound or other tests later in pregnancy. But for many hereditary health risks, CVS provides accurate and early answers. Overall, sampling chorionic villi during CVS helps families learn about potential genetic issues early on. This early knowledge allows them to seek support, consider options, and prepare for their child's future. If you're thinking about genetic testing during pregnancy, discussing it with your doctor or genetic counselor can help you decide if CVS is right for you. It's all about making informed choices to support your family's health and well-being.